You're watching Let's Chat.
It's so good to have with me in the studio today Dr. Paul Hoffman with CHI Memorial to tell us all about physiatry and what that means. Thank you so much for coming on, Dr. Hoffman.
Well, thank you for having me here today.
Physiatry, physical medicine. What is this?
Physical medicine is a specialty that was formed actually right after World War II, and our goal is restoration of function. We study orthopedics and neurology and neurosurgery, combine those together for the treatment of people with neurologic and musculoskeletal disease. I specialize in that. Within the area of physiatry, I specialize in spinal problems that people have.
So if we have viewers watching, who do you treat and how would someone know if they might need to look you up?
So I'm a doctor that specializes in chronic back problems or acute back problems. So we look first. My first role in treating a patient is to get a proper diagnosis. So patients that have not progressed with simple things, working with their primary care physician in back problems or sciatica as it's commonly known, then they'll come see us and we can properly diagnose what's causing the problem and then focus therapy on trying to get them better.
Now, speaking of therapy, trying to get them better, maybe tell our viewers who are discouraged with back pain that there's hope out there, because I know a lot of people live with chronic back pain.
Absolutely,
it's depressing.
It's terrible. It just really destroys people's lives, and it leads a lot of people down a road of medications that they really want to stay off of. So our goal is to really try to keep people off of long-term chronic medications and try to get them again, a proper diagnosis, get them treated. And I act as a conduit as well towards surgical intervention if patients need it.
Right.
I work very closely with my neurosurgical colleagues, but surgery is not the first thing we go to with people with back problems. We utilize things such as physical therapy, we use adjunctive treatments. I really look at a patient in a holistic approach, trying to look at their function from a musculoskeletal standpoint, exercise, education, and then we do interventional things such as for people that have like a sciatica, that their nerve root is irritated, we'll use an epidural for those. We have developed things such as radiofrequency ablation, where we can burn the little nerves that go into the back where the arthritic areas are, and that procedure has really come a long way in the last 15 years of being able to help folks.
So there's many treatment options, because there's a myth out there that a spine doctor is going to jump right to surgery, and that's what he wants to do.
That is the last option for folks.
I love hearing that.
Yes, absolutely the last option. Or patients that are having, what we call red flag signs, such as progressive neurologic loss, where they're becoming weaker, or we just can't get them better from their severe pain, that we may need to move towards surgery. But it's a very small minority of patients. Most of our patients, the first step is proper diagnosis.
And is that like a consultation basically, and then from there there's many different options you could go out to?
Absolutely. So we get with the patient, we look at them from a functional standpoint, careful examination, then we review the MRI, which we independently read in our office. We don't just take a report from a radiologist. We sit down with the MRI ourselves, independently look at that, and then share the MRI with the patient so that they know, or the x-ray findings, so they know what the pathology is. And one of my main roles, I feel, is education. Because when patients know what's wrong with them, then they can help get themselves better.
Well, you seem like a very nice doctor, so I hope our viewers give you a call if they're struggling with this. How can we set up an appointment?
So I think you got the information there about our office. If they're an established patient, I've been in this community for about 20 years, and I'm just now joining the Memorial Neuroscience Institute. My established patients can just call the office, but for new patients, we prefer a referral, just so that we can get the information together, so when we see me, I can have a more fruitful visit with them.
It's a real team. Well, thank you so much for coming on, Dr. Hoffman, giving our viewers hope that are struggling with that, not to be afraid. So CHI Memorial Neuroscience Institute, the phone number is 423-206-9480. Thank you again for coming on the show.
Thank you so much for having me.